Hello and welcome to Rajya Sabha Television. I am Vishal Dahiya and you're watching our special show, India Fights Back, wherein we talk about the preparations as far as India is concerned for COVID vaccination as well as all other aspects vis-a-vis COVID pandemic. Now, today we have a special guest with us and he is Dr. V.K. Paul, a member Health NITI Aayog. He is also the chairman of National Expert Group on the COVID vaccine administration and also member of the National Task Force and chairman of one of the empowered groups of that task force on COVID. Today, we're going to talk about all aspects of COVID vaccine and we will seek more details, more information. We'll try and understand more about these vaccines from none other than Dr. V.K. Paul himself, who's at the center of this entire process. Welcome to Rajya Sabha Television, Dr. Paul. And let me begin by congratulating you and the entire team and all those who've been involved with this entire vaccination process on this very significant situation which we are in right now. That is, the vaccines have started reaching, all corners of the country. And the process is all set, which will begin on 16th of January. So let's start by knowing more about this vaccinations, schedule and program for COVID.
Well, yes, the country is moving to the phase of vaccinating a large number of our citizens in our fight to control and to extinguish the pandemic. We are very fortunate that we have two made in India vaccines that will form part of the vaccination program as we start with. And the program is going to be launched on the 16th of January in a stepwise manner. We're going to start with healthcare workers. And eventually, of course, we will have a large group of individuals, as many as 26 crore, who are above the age of 50 years, who will form the major focus for the first wave of vaccination program in the country.
Okay. And in terms of, this particular program and the schedule which is there, you spoke about how the healthcare workers, the frontline workers are the priority here. How will these, this vaccine administration move ahead? Because there are two vaccines and both of them are being shipped to various corners. So is there a process where it has already been decided that, the X area will get one particular vaccine and the other area will get another vaccine?
Well, yes, both the vaccines are to be used as we start. They will be available to the state governments to be taken to scale through the vaccination sites that they will assign as to where vaccine A will go and where vaccine B will go. But indeed, both the vaccines will be used. Both the vaccines are safe. Both the vaccines are highly immunogenic. And both the vaccines will be impactful in achieving the objectives of the vaccination program. We are starting with a priority group in the first wave of immunization program, which will cover eventually 30 crore people in the next 7 to 8 months as a part of the rollout. And this includes, as I said, the most important group are 26 crore people who are above the age of 50 years. And why we have picked up this group is because when you look at mortality, deaths due to COVID-19, then 78% of deaths occur among individuals who are above the age of COVID-19. And therefore, who are above the age of 50 years and who get COVID-19 and they succumb in a larger proportion. So they have a higher risk of mortality. So if we cover individuals, if we cover our citizens above the age of 50 years, we are able to dent the mortality due to COVID-19 in a very dramatic manner. And that is the basis of this thinking. Also, age criteria is a relatively robust and relatively scalable and easy criteria to work with because age records are available in multiple forms, even in the context of our rural brothers and sisters. Remember, this is an adult vaccine, so we are looking at people who are above the age of above the age of 80 years in principle. Having said that, our second group, other than the healthcare workers, is the frontline workers. These are the people who have been engaged in controlling the pandemic. They are the people who are municipal workers, sanitation workers, people, police people, traffic police people who have been in the forefront of managing the pandemic and making sure that the pandemic system, control system, is effectively implemented. So we have healthcare workers, about 1 crore. We have 2 crores of frontline worker, and then we have 26 crore people above the age of 50 years, and also 1 crore additional people who are below 50 years but have significant diseases. And these diseases, such as severe diabetes, liver failure, kidney failure, heart failure, cancer, which increase the risk of these people should they get COVID-19 disease. So this in totality makes 30 crore people. This is currently the focus as a public health focus, because this will help us achieve these priority objectives of the vaccination program. Remember, there are
Okay.
other objectives of vaccination program, and ultimately those include totally extinguishing the pandemic by creating a total herd immunity. But that would mean we have to immunize more than 60 to 70% people, and that will happen in due course. But the first focus is to protect our healthcare workers and pandemic control teams and look at those people who are predisposed to mortality, and therefore to protect them, the elderly and those with comorbidity. So that's the way it is. In between, will have the groups in increasing size of the circle to cover other individuals below the age
Mhm.
of 50 years. And this is, of course, contingent upon the fact that we will have sufficient, continuous, and increasing stockpile of vaccine being available.
Okay.
The prioritization is required because at this moment in time, for several months, the supply of vaccine, in spite of we being a very major producer of vaccine, is much lower than the potential demand of the vaccine, and therefore prioritization has to be undertaken. And this is the approach all the other countries are also taking.
Okay. Okay. That clearly explains the prioritization, the need for prioritization, as Dr. Paul is pointing out. That also brings us to another very important aspect of this vaccination drive, Dr. Paul, and that is the use of technology there, specifically the Co-Win app. And that particular app, if we look at, seemingly is the backbone of this entire process, ensuring supply chain management, also, ensuring that all records are digitized. So how is that being done as far as Co-Win app is concerned as of now? And when will that app be, open for public use? When will a general public come into picture for, downloading that app or registering on that app? How will this process move forward?
The CoWIN IT platform is a very comprehensive and a robust platform. You would imagine that today, if we have to mount a very major, wide ranging, nationwide mission of vaccination, or for that matter, any mission, IT will be our friend and IT will be our enabler. And therefore, it is but natural that for organizing this program, the mission, we are depending upon IT as a very important fabric of the program. And you
Mhm.
use the word backbone. Indeed, it is the backbone of the program because it is going to be used for multiple functions. First and foremost, it will be used for logistics management, looking at how the vaccine is moving down the cold chain system from the factory to main hubs, to state hubs, to district hubs, and so on and so forth. Exactly how and how many doses are moving along this channel, and how the supply chain is to be practically, rationally implemented on the ground. It also has, it is actually tracking also the temperature of the vaccine carriers in real time. It has that capability. Then there are other aspects. This will be used to list the people who will do the vaccination and take part in conducting the vaccine sessions. It will more importantly list individuals who will receive the vaccine, which means a very large population. And you know that in the first wave, I said 30 crore people. Eventually, many other crores of individuals. So it lists people who are the beneficiaries, who are to get the vaccination program, to get the benefits of the vaccination program, and they are listed, and they will know that they are on the COVID app, and therefore they are entitled. They will be told that they will come for the vaccination session at a particular location on a particular date. They will receive the first vaccine, and then the app will tell them when to come next and where to come next, and so on and so forth. Eventually, once the vaccination is complete, they'll get a digital certificate as a proof of having received the vaccine and also the type of vaccine.
Okay.
In addition, another aspect which I want to touch upon lastly is that this app is also critically importantly being used to set up the vaccination sessions. So it picks up the beneficiaries, it picks up the team, and tells the teams where and when to set up a site for vaccination, a booth for vaccination program, in terms of physically where to go, on which date to go, and which team would be responsible for conducting vaccination at a given vaccination site or a vaccination booth. So it is logistics, it is micro planning and implementing the vaccination program on the ground, and it is an interface with the beneficiaries and outreaching to them to alert them, to list them, and to work with them to ensure that they are receiving the benefit, receiving the doses in a systematic way.
Okay, that clearly underlines the role of technology, and that's quite significant and important out there, as Dr. Paul is pointing out. One more aspect, Dr. Paul, since you referred to it in your earlier response, that is about the immunogenicity and safety and efficacy of these two vaccines, that is Covaxin and Covishield. So in terms of the data which is available and based on which the approvals have been given, to assuage any concerns as of now, which may still be left, how would you define the safety and the efficacy and immunogenicity of these two vaccines, which are now going to be used for this vaccination program?
The two vaccines, namely the Covishield vaccine manufactured by Serum Institute and Covaxin manufactured by Bharat Biotech company. And this is an ICMR biotech collaboration, and it's an Indian virus which has been used as an inactivated virus for the vaccine preparation. The Covishield is based on a chimpanzee adenovirus vector. So these are two different types of vaccines, and today the world has a few other types of vaccine. Notwithstanding that, both these vaccines today have emergency use authorization by our drug regulator based on the recommendations of the experts within the drug regulatory subject expert committee system. Remember, today all the vaccines, including the ones which are used in other countries, such as Pfizer and Moderna, and Sputnik for that matter, or the Chinese vaccines, are all under emergency use authorization. And that means that their trials, the final phases of trials, can go on, but there is enough comfort and enough evidence of benefit available and data available on safety and immunogenicity and so on, which gives us the comfort, which gives these experts the comfort that you can start immunizing people in parallel. So all vaccines today are under emergency use authorization, including the ones such as Pfizer and Moderna. The country took a decision to exercise the same emergency use authorization through the drugs regulator, through the experts, to give the same option to the two vaccines, namely Covishield and Covaxin.
Mhm.
Their phase 3 trial will continue, the data will continue to come, and someday they will have regular authorization, which is called marketing authorization. That will happen in due course for all the other vaccines. So much about the fact that these vaccines globally are being fast tracked
Okay.
uh, after you have a comfort zone in terms of the data availability. As I said, the Covishield as well as Covaxin is absolutely safe vaccine. In fact, among the safest of the vaccines.
Okay.
The side effects we now know quite well because both the vaccines have been given to thousands of people. Uh, Covishield for about 24,000 people, and Covaxin to single dose to 23 odd thousand people, and additional doses to a few other thousand people, and then phase 1, phase 2 volunteers have also received. So there is a very definite evidence that the vaccines are safe, they have negligible and minimal side effects such as little local pain, maybe little fever. And that's it. These are not significant side effects at all. And vaccines do excite some little reaction. But beyond that, these vaccines are among the safest, among the lowest in terms of their side effects.
Okay.
This is the first part. The second part is that both these vaccines have demonstrated very robust, very deep, very significant immunogenicity, both for antibody titers and for Covaxin, actually antibody more than just the S protein,
Mhm.
and it's also nucleocapsid protein, another protein, because it is a whole viron. It's all full virus particle. Others are targeting only one type of a part of the vaccine, part of the virus antigen. So both have shown very robust immunogenicity against the concerned antigens, and also this immunogenicity spans in a robust way in the T cell system, which is for the long-term protection and the effect of the vaccine. So remember, these are very, very well demonstrated immunogenic parameters on
Okay.
which the vaccine impact will be dependent upon.
Okay.
And then, of course, we have data from human studies, and based on all this, the regulators expert group felt that under the paradigm of emergency use authorization, both these vaccines are ready to be used in the program mode for the country.
Okay, okay, that should settle down all the doubts as far as the safety, efficacy, and immunogenicity of these two vaccines are concerned. One more question here, Dr. Paul, is that apart from these two vaccines, there are other indigenous vaccine candidates which are in various stages of development. So, if you could tell us, and our viewers a bit more about some of these candidates, various stages they are in, because as you pointed out earlier, to take this vaccine program to the next stage, more vaccines, more dosages will be required. And if there are other vaccine candidates also which are cleared, then obviously this entire process will become much more easier.
Yeah, it is true that we need more doses of the available authorized vaccines as much as possible. But we are also, the whole world needs more vaccine also, because then it provides choice and it provides a wider net and menu of options and purely more volume above all. And India, in this regard, is again very fortunate. There are multiple vaccines in the pipeline, and some of them which are doing very well is Cadila Zydus DNA-based vaccine, which has now been granted permission for phase 3 trials anytime phase 3 trials would begin. This vaccine could be available as a choice in 3 to 4 months' time, I guess. Similarly, we are collaborating with the Russian teams for Sputnik 5 vaccine developed there, but it's in phase 3 trial with one of the Indian laboratories, and there is a clear intent to manufacture this in the country, and therefore that's another vaccine to be watching. Then we have Genova RNA-based vaccine uses the RNA technology used same technology being used by Pfizer and Moderna, but this vaccine is stable at 2 to 8 degrees, unlike the other two, which
Mhm.
need much deeper ultra cooling system, particularly the Pfizer that requires minus 70 degrees. So this is an Indian vaccine, which is in phase 1 to 2, which means safety and immunogenicity
Okay.
level by Genova. And then we have biological E vaccine, which is also in phase 1 to 2. So these four are in a very proximate pipeline, in addition to the two that have been granted the licensure and authorization. So we have and then there are others behind this. There is one vaccine which is based on nasal drops. Can be given single dose nasal drop, one drop, and it is done. That top vaccine is also being developed. There are others using different platforms. So there are not only these 2 plus 4, 6,
Mhm.
but also there are 2 to 4 to 5 more vaccines further behind in the pipeline. And
Okay.
therefore, we have uh, more optimism as we move into future. But remember, while we need all this to come up, while this all will come up as well, and we will have significant volumes and a choice, remember, at this point in time, we have to be working with relatively limited doses of the vaccine, and therefore we have to go back to prioritization. Someday there'll be plenty, but hopefully not into far into future.
Mhm.
But presently, we have to be strategic. We have to focus on the high priority groups. And
Okay.
that's what exactly we have done. And therefore, I want people to know that someday there will be plenty to be obtained here and from everywhere and so on. But till that time, we will have to prioritize the vaccination of the people who are most vulnerable and most needy and most justifiable as a society. And we, the rest of us, should wait for our turn when the turn comes. And by that
Okay.
time, there will be perhaps other vaccines in the game, and we will all have access to vaccines.
Okay, okay, definitely. The ones you mentioned, and clearly the list clearly shows that there is a lot of development which is happening as far as vaccine candidates are concerned. One last question, Dr. Paul here, and that is about two aspects, as you explained about the safety, efficacy, and immunogenicity part. Since this is an adult vaccination program, the experts also point out that the biggest challenge is to tackle the vaccine hesitancy part. So what exactly is being done to tackle that? And also the fact that vaccine is here should not, let us lower our guard. We can't lower our guard vis-a-vis the COVID pandemic because the virus still exists.
Well, both issues are very important, and they are essentially the subject of communication, dialogue, persuasion, and working as a team, as Team India, to defeat this virus. So let's come to the first one. Why should there be a vaccine hesitancy? We are facing a pandemic which has destroyed lives, which has destroyed, you know, uh, the social fabric in terms of the way we were, conducting ourselves socially. It has affected our economy. It has disrupted the whole system globally, not just in our country. And vaccine gives you an opportunity to save yourself at individual level, to save other people getting, you know, infection from you, because you go home and you could infect your family members. And then, of course, from there to the society. So, vaccine is the option which is protecting you, your family, society, and the nation and the world. And therefore, we should be grateful that mankind has an option to exercise thanks to science, thanks to technology, and thanks to a great industry, vaccine industry, and more so our own vaccine industry and our
Mhm.
own scientists. So this is where one should be careful about. Remember that virus hasn't gone anywhere. It is still around. Remember, it comes in waves, as we have seen. It should. I hope it. We will never have a second wave, but you can't take it for granted. And till now, we were fighting this battle purely, almost literally, with bare hands, and we were trying to protect ourselves with mask and distancing and so on. But today we have a weapon which is formidable to ward off the virus.
Mhm.
Therefore, we should be grateful that we can exercise choice as Indians, and therefore, please, there is no reason why you should not agree to be vaccinated in your own interest and the interest of pandemic control, which means the societal interest. When the regulator and the government most responsibly has cleared to vaccines, have faith. These
Okay.
are excellent vaccines. Use them. And I'm particularly appealing to health workers, our nurses, our doctors, our safai karamcharis, our ambulance workers, and specialists, and everybody, and medical students, nurses, that please embrace this. Do this as an example, because we know the science and the research behind these
Definitely.
efforts, and we have to be protecting ourselves
Mhm.
because we are engaged in care of critical patients, and also we have to protect ourselves to be able to protect our families. Therefore, please start. The nation has offered the first offerings of the dose to healthcare workers. We should
Okay.
embrace it. And from then on, it has to be embraced by everybody, should be embraced by everybody, not just as a personal benefit, but also as a societal benefit, because I could be the medium of transmission.
Okay.
So vaccine hesitancy should be should be put away. We should embrace, and whoever has been listed, or whoever has been give fulfill the criteria for
Mhm.
vaccination today and tomorrow and onwards must embrace it. This
Okay.
is in our interest.
Okay.
Second
Definitely.
issue is, yes, even when the vaccine program picks up, we cannot lower the guard in terms of COVID appropriate behavior. We have to
Uh-huh.
be continue to wear the mask. We have to maintain social distance. We have to wash our hands, and we have to be very careful in several months to come.
Mhm.
And it is only when the transmission of the virus will be demonstrated by our scientists that it has been extinguished, the chains of transmissions have broken.
Okay.
We, as scientific community, will come back to you and say, okay, we go back to our normal ways. But till such time, vaccine is to be coupled with our other four strategies, namely COVID appropriate behavior, aggressive testing, containment, uh, and contact tracing, isolation, quarantine, wherever required, and also the clinical care of positive cases and sick cases, if
Okay.
need be, in the facilities. Thank you.
Okay, okay, that is indeed sums up all aspects of the vaccination drive there. Thank you so much, Dr. V.K. Paul, for sharing these views and this information with us and our viewers as far as the vaccination drive is concerned. The vaccine is here. All preparations are set for starting the vaccination drive on 16th. And as Dr. Paul was pointing out, let us tide over the vaccine hesitancy. Let's embrace these particular vaccines. They have been proved safe, efficacious, as well as their immunogenicity has also been proved. But Alongside, also, as Dr. Paul pointed out, let's not forget about the COVID-appropriate behavior, something which all of us needs to follow. It's a 3 simple step behavior, that is, wear your mask always, ensure that you wash your hands regularly, hand hygiene is equally important, and maintain physical distancing of 6 feet. These 3 simple steps will keep you and your near and dear ones safe and healthy as well. Thank you for watching Rajya Sabha Television.